we have Roberto Baldizon, who is the founder of Silibrain. Roberto is a Guatemalan native and Penn State graduate, and he possesses a solid academic foundation in science, math, and informatics. He gained practical experience by working in his family business before launching ventures focused on things like energy solutions, healthcare software development, and radiological equipment and installation. At Silibrain LLC, he leverages AI for patient engagement tools, prompt disease diagnosis, and rapid testing. So with that, Roberto, take it away.
Thanks. I'm going to share my desktop. So I see some familiar phrases. For some of you, this will be a little bit repetitive, but I think it's a great opportunity always to share what we're doing and some of the things that we think that could be potential opportunities in the healthcare field. So in Silibrain, we focus on making practice effective and patient-friendly by developing patient engagement tools. You heard a little bit about me. That's me in Medica presenting a decentralized EHR solution, which actually resonates with a lot of the talks that we heard today. Then another co-founder is my sister, who also works with me. She has experience working with biotechs while she worked in Ernst & Young. And then we have a team of advisors that focus on their specialty. So Dr. Claire Donat she's a mathematician. Dr. Winbury, he's a microbiologist and a global remote developers. So because of that, not only do we have our own product, but we also develop solutions for other people in case there's an interest. So we've done EHR records, we've done e-commerce apps for pharmacy. And the most interesting one that resonates a lot with what we're doing right now was our AI for enhancing antibody testing during the pandemic. So during the pandemic, working with Dr. Brembury and Dr. Donat, as well as with about 30 other researchers, we were able to build for them this questionnaire, which was medically designed, that would get all the relevant contextual evidence that would be important in aiding the diagnosis of an infectious disease, which in this case was COVID. And with that, and keeping it, of course, without any identifiable data, we were able to provide them a solution that was easy to understand in a way that was visual, easy to share, and that was a little bit more accurate than the actual antibody testing. So even though out of the box, the box would tell you it's a 99% accuracy, the actual accuracy we found through our research for rapid testing was about 70%. Not only that, but with the contextual evidence, we were able to increase that accuracy to 86%. So with that, we actually started launching it, and it was very useful during COVID for many of our partners that we work with, especially for those that didn't have X-rays or CT scans or highly advanced radiology solutions. Our current project is Vibesdoc, which is very similar to Cody in that sense, that it's a patient engagement tool that focuses on the patient's symptoms and connects them to physicians or institutions that would be able to help them the best with that. So the main difference, I would say, is that we're not limited to COVID now anymore. We're focusing on more diseases. The patient goes into a site, fills a survey, like other symptom checkers that are out there, like WebMD, for example, that has one. Then they would get suggestions of potential things that might be going on. And right next to that is a WhatsApp link for that clinic or physician. So we're using WhatsApp because we're focusing on our local market in Central America, as well as underserved communities in the United States, which also have a high percentage of WhatsApp usage. So that would be the main gist of it. And then for the actual patient, it will be almost like the experience of talking to a chatbot, very similar to that. That wouldn't be that much of a difference. Same thing for the clinic. It would be like the experience of managing other softwares that have chatbots that they can manage a lot of other users as well as other patients, and it allows them to aggregate and increase demands for their clinics. It would also reduce patient anxiety while increasing treatment adherence, we believe, because we're actually having them be more participative in their treatment. It's not only up to the physician, but it also allows the patient to feel like they're doing something about it. We think that there is a potential for synergistic collaboration, as it allows for easy participation and then follow-up of physicians, as well as to find specialists that are lesser known in some communities, and to have patients understand a little bit more of what they're going through in simple words. We think this is important because we know the population is aging. During COVID, that became obvious, especially in places like Latin America, where even though we have a lot of young people, because of the poorly designed systems as suggested before, it was actually the region of the world that was hit the hardest. Same thing even in the United States with Latino communities, even though most of the Latino communities is quite young, it was hit pretty hard. We can speculate about a lot of things, but at least one of the things that we're definitely targeting is actually just increasing that patient engagement, having them feel comfortable in sharing whatever they're feeling, the symptoms, and then finding the potential practitioners that could actually help them with that. The number of physicians is also still low in most places. In Latin America, it's obviously lower than in other regions. And the number of hospitals, specifically in our initial target market, which is Guatemala, El Salvador, Honduras, Nicaragua, is very divided in depending what section of the country you're in. If you're in a city, then maybe you have access to, well, not maybe, you have access to almost the same amount of hospital beds as you would have in other places in Europe. But if you're in some of the other places in the rural country area, then you don't really have any access to healthcare facilities or testing facilities, which is why connecting them is very key for such treatment. All through the world, it's similar, but in Latin America specifically, we see a particular trend in which we see that Argentina is the only country that has an acceptable perception of healthcare delivery. And that is because they have a high number of medics, and as well as a high number of hospitals. They even have more hospitals than Brazil, even though it's a way smaller country, almost double the amount of hospitals in Mexico, even though it's also a smaller country than them. And Central America, as you saw, it's even a little bit behind of that. So that leads to these countries, as well as the Latino community in the US, because it's the same culture, be more dependent into pharmacy and having the healthcare coverage there. So as we see here, it's interesting that Guatemala is the #1 country in Latin America, where the percentage of healthcare expenditure is in pharmacy, as being 34% of whatever is spent in healthcare going just to pharmacies. The reason is because a lot of these people end up just trusting their pharmacies more than the practitioners for a number of reasons. And that's where we think there's an opportunity to fix that. The perception of care in most of these countries, as suggested, is not good, with the exception of Argentina because of the large number of hospitals. But even other countries that are developed, such as Chile, doesn't really have a good perception of healthcare delivery. So while doing this, we have had the opportunity to gain experience in collaborating, developing or tailoring software solutions for specific hospitals in rural areas, such as this one, which we have also connected them with other institutions, as well as some of the radiological equipment, which we have been able to consult for and then install. So that's MRI, CT scans, cath labs. And while doing so, we have also been able to have students from these universities cooperate with innovative projects, which allow them to gain experience. Lately, we're also starting to collaborate with NGOs, such as My Heart, Your Heart, which is it's a very interesting organization. They just gained FDA approval for sterilizing pacemakers, and then we're connecting them with other institutions in developing nations, especially right now in Central America, so that that can be a reality. Same thing with the Embassy of India. We're doing an ophthalmological campaign, and then all of the things are connected to the tool that we're using. So if we got your interest or you have any questions, suggestions, please feel free to reach out, and we'll be glad to share whatever information we can with you.
Thank you so much. Great presentation. And we're going to open it up for a couple of questions. So if you guys want to go ahead.
I have a question about privacy. Go ahead, Faye.
No, go ahead.
I have a question about privacy. I noticed on one of your slides that you are utilizing WhatsApp to connect patients with the teams. So are there any like privacy concerns or security? And that may differ country to country, right?
Correct. Yes, and that's also why we're focusing on the countries that I suggested, is because so regulation is still lax there, and with the exception of the United States, where mobile health apps do have regulation regarding privacy, but our own app doesn't really capture any of that. We only ask the questions surrounding the case, and then whenever the patient or the user decides to click on the potential doctor or physician or institution, that's when they decide to share whoever they are with the institution, if they want to. Because anyways, like it's a WhatsApp number. It could be without any names if they really wanted to. I don't know if that explains it a little bit more. So regarding to privacy, yes, you're right. It's something that we're looking at, and that's why it's for the next phase of the project and doing further developing the solution for more developed markets that have stronger regulation in that, specifically the ones in Europe that are very strict regarding GDPR and those. That's something that we would need to look at later at a later stage.
One more question, and then we'll do the remainder in chat. Go ahead, Faye.
Roberto, a lot of interesting kind of projects and initiatives. How are you then related to them? Is it more like consulting development services, or do you then own co-development partnerships? I was trying to understand this portfolio of initiatives you're working on.
Yeah, sorry, I guess I tried to pack in too much in the presentation. I noticed later, but so we mostly co-develop projects. In the sense that we have our own project, and then they have their own initiative, and we connect them with other institutions and tell them, okay, we can do this campaign, and then we can use our app, such as Vibesdoc, to allow the users to communicate and find the physicians that they need. So it's it is as external role, but we do leverage whatever networks they have and whatever resources they would like to share with us.
Great, fantastic job. Appreciate all the questions. If you guys